Living in harmony is possible if you know your emotions and how to handle them. In this podcast, Dr. Carmen Roman will share with you in an engaging way the current psychology by sharing herself or interviewing experts who will inspire you. Learn how to live a life of fullness and how to recover your emotional harmony with Dr. Roman. Welcome to Emotions in Harmony. Hello, my podcast listeners. We are here with Dr. Steve once more time. Thank you, Dr. Steve, for being here.
Thank you for having me back.
Well, it was very successful last time you were here. We laugh and we have fun, and people is having fun with the other episode.
Good.
Yeah. So if you want to listen Dr. Steve episode about ending the battle with emotions, go to episode 7. And it's there. Yeah, you will hear from him. And today we are going to talk about how to choose a therapist. It's a very important topic. And I'm looking forward because sometimes we don't think about how to shop around for therapy.
Yeah, I mean, this is an important decision. It's not like you're going out to shop for socks. And so, I mean, this is someone that you want to work with that's going to be helpful to you, that you feel comfortable with, that you can trust. And then you have to find the right one for you. So it's worth taking the time to kind of doing the due diligence or putting in the effort to do a little bit of research and to find someone who's really going to work well with you. Yes.
I think there is not that much information for consumers about that.
No, and that's unfortunate, I think. And so hopefully this will at least help some people start to think about how to do that well.
Yeah, that's right. So what are your thoughts about it?
Well, I think a good place to start is to ask yourself, why do you want to be in therapy? And if you know you have a particular problem, let's say you have an eating disorder, then it makes sense to maybe start your search right away with the people who specialize in treating eating disorders, because that's how you're going to get the best care. It doesn't make sense to, most people are more experienced with the medical profession. So, if you broke your foot, you don't go to the ear, nose, and throat doctor, right? You go to the person who deals with broken bones. If you have cancer, you don't go to the urologist, you go to the oncologist, and so you go to the people who spend the most time working with these issues. So they're, presumably they're better at it than someone who doesn't spend a lot of time treating that particular issue. So that's one way to start winnowing down your choices.
How do I know if it's my nose or my feet in psychology? Because I just feel bad.
Yeah. And so you're right. That's a good point. Sometimes you don't know. You just know, I feel bad. Life seems extra hard.
I cannot sleep.
You can't sleep. I'm not eating well, or I'm eating too much. And then I would just kind of bracket that for now. And then you can have that and save that for when you talk to an actual therapist.
Okay.
And if they're hearing it and they kind of get a gist, like, oh, I think that's something that I treat, then you can schedule a point and talk more about it. But if they're hearing, oh, no, that sounds like something different.
Okay.
Most therapists try to maintain a list of people they know. Like, well, I treat this stuff, but this other guy does a really good job with this. And most people will try to give you a couple names of people like, well, I don't do that, but here's a couple of people I know who are good at it, and can kind of point you in the direction that way. But you're right. Sometimes you don't know what's going on with you. And so even if you had to just have an initial session with a therapist, if only in that session you figured out what was going on, that would be worth the time and the money in my experience. Because then if the therapist treats it, great, and you're a good match, great. Otherwise, they can start helping you look for somebody else that could be more of help to you.
Okay, that's nice. So I can go to the therapist and they will help me to fine tune.
Yeah, it's a lot like going to a primary care physician and then they realize, oh, you need to see a neurologist, or, it's sort of a similar process.
That makes sense. So tell us what else you have. What else you...
Well, once if you know what's your issue or you die, the next thing to sort of think about, what sort of therapist do you think you'd be comfortable with? Would you be more comfortable seeing a man? Would you be more comfortable seeing a woman? Maybe your particular ethnicity or sexual orientation or some other life circumstance. Maybe you'd be more comfortable who specializes people from that culture, that sexual orientation, or whatever it is. It's really important that you feel comfortable with a therapist and feel like they really understand you. So if you know that about yourself, pay attention and add that to the criteria that would work good for you. And again, it might not make any difference. Most therapists are pretty good about, dealing with all sorts of ethnicities and orientations and do their best to make people feel comfortable and work with them. But, if you have a particular preference, it's okay to have that preference.
I wish sometimes when I choose for a therapist that Yelp will be more helpful. Yeah. Because if I choose for a restaurant,
yes,
I can see all the comments and pictures and whatever. But if I choose for a therapist, there is no service or nothing like that. So I need to find out on my own.
Yeah, I think it's a good point. I think Yelp is not really suited well for rating therapists. And because therapy is such a complex thing and people often, have issues that they're not aware of that are coming out in therapy. And if they're unhappy about that, often they leave a really awful review on Yelp. Whereas maybe if they had waited till the issue was resolved, they would see it in a different light.
Yes.
So it's really hard I would take Yelp reviews with it like a huge grain of salt.
Okay.
And I would look more at just go to, most therapists have a therapist profile on like Psychology Today or Network Therapy or Good Therapy or some, go look what they're writing about themselves.
So Psychology Today is one.
Good,
you say
I think Network Therapy is another one.
Therapy?
And goodtherapy.org is another one.
We are going to put in the show notes.
Okay. I'll be happy to do that. You can also do your due diligence. You can go to their licensing board. Okay. If they're psychologists, they'll be on the board of psychology. If they're an MFT or an LCSW, they'd be under the BBS, the Board of Behavioral Health. You can see if, are there any complaints against their license or, just to make sure they're on the up and up. Another way to look at that is maybe you have friends who've been in therapy.
Okay.
That might be willing to talk to you, not necessarily about all the gory details, but, did it help? Did you feel comfortable with them? A lot of therapists get most of their referrals through word of mouth.
Okay. So I call the therapist and what I say.
My name is so-and-so. I saw your name on Psychology Today, or a friend gave me whatever. I'm interested in therapy. Do you have a couple minutes to talk? Okay. And it's like, here's what I think is going on. Does that sound like something you could help me with? And they can answer yes, no, I'm not sure. It's a good time to ask about, do they accept insurance? What are their fees? That sort of thing. And if pay attention how you feel in having that conversation.
What about if I play the role of the client and I call you?
Okay.
Yeah?
Yeah.
Let's say I'm going to call you and I'm going to need therapy from you in Mountain View.
Okay.
Yeah.
Yeah. Well, it's good because I'm located in Mountain View.
I'm looking for a therapist in Mountain View. So I will call. Ring, 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 ring. Dr. Steve, I hear from my friend that you are a therapist and I am looking for a therapist. So can you treat me?
I don't know. Why are you looking for a therapist?
I don't know. I am not sleeping very well and then I think I am getting divorced. I don't know very well if I am getting, but I think something is going on with my relationship.
Okay. So are you looking for couples therapy or are you looking for individual therapy to figure out how you feel about your relationship?
I don't know. I don't know how much it costs and I don't know if it will be couples or individual, or I don't know if my husband wants to go.
So my fee is $200 an hour. Mm-hmm. I have a certain amount of slots where I can do sliding scale if that's appropriate. What I would suggest is that we have an initial session and maybe we can tease out what would be best. maybe couples therapy would really be the best. Maybe, working with me and kind of sorting out how you feel with a relationship might be best. Maybe a combination would be best, but we could talk and maybe we can help you get some clarity on where to go next.
Oh, that would be really helpful. Should I bring my husband and my kids or just me?
Why don't we start with you?
Okay.
And then we can go from there. And the only reason I say that is just I don't do family therapy and I don't do couples therapy. So if that was what was needed, I would need to help you find a referral and help you find someone else to do that with you.
Okay. And do you take my insurance?
I do not take insurance, but I'm happy to provide a super bill so that you could bill your insurance yourself and then you would be reimbursed.
Okay, so that I need to handle myself that.
For that, yeah.
Or you may know somebody who take my insurance.
Possibly. I could go on a listserv and after we met and I got a clear picture of what you wanted, I could send an email anonymously where I have someone who's looking for this, who wants, who has such and such insurance. Is there anyone out there? And usually I'll get a number of responses and then I'll just pass those on to you. Okay. And then you could call and make an appointment.
So I have other questions that I guess I can ask you once I am in the session. Yeah, like how many sessions I will need or something. So I guess I keep my questions for when I see you.
I think that would be helpful. It's really normal to have a lot of questions.
Okay.
And so, and I think it would be easier to answer them in person. Mm-hmm. So I would suggest, we could schedule an appointment. I have some slots open and go from there.
So it doesn't work and you tell me this first session, I still need to pay the $200?
I do, because I've given you my time. And so this is how I make my living. So I need to be reimbursed for my time.
Yeah, let's go ahead. Thank you, doctor.
You're welcome. I look forward to seeing you.
Yeah, I think it's not as scary, yeah?
The scariest part is getting yourself to dial the number.
Yes.
That's the hardest thing.
Yeah.
And after that, it gets easier. Especially when you find someone that you really click with and trust. Even though if you have to work through some difficult material, you really know that they're there for you and it's easier.
And also I want to add here that it's okay if some psychologists don't answer, that you can call other psychologists.
Absolutely. I would recommend finding 2 or 3 that you've seen their profile and I think that might work for me. Call 2 or 3, even go visit 2 or 3, have an initial session and shop around and see how you feel with them and how do they answer your questions. And, is this someone I think I can work with? And when you sort of know, okay, this is the one I want to go with, then go with it. But this is like, I think it's like the order of magnitude of like buying a house. It's a significant investment of time and money, and you really want to have one that works for you.
That is a very good point, because I have some clients that call and I want to be seen immediately. They call in emergency, sort of. Mm-hmm. And like, I want you to treat me. What is the appointment you have today or tomorrow? And as a therapist, I have a lot of doubts to take that client, because they didn't do the homework. They probably want just that session and they will not come. So I am going to invest also my time and my energy.
Yeah.
But it's kind of seen. I will put the metaphor of somebody who only goes to the dentist when the pain is so.
Yes. I think, there's a lot of patients that we treat that are genuinely suffering and a lot of pain. And of course you want the pain to go away as quickly as you can. But, therapy is not like this quick fix thing. And it's worth being able to take a deep breath and slow down. And when I get those calls, I'm like, I just say, I really hear that you want to work on this. And I'm not sure whether I'm the right person to do that. Here's what I suggest. Let's have an appointment. I don't have anything today, but maybe I can do something, a couple days or next week. And let's meet and let's talk about what's going on. And then when I have a sense of going on, we can start making decisions about how to go there. If it's something that I treat and I feel like, yes, and you feel like, yes, this is a good match, then we can proceed. But if not, let's find you somebody else that's really going to work for you. And so I try to slow them down. And I'm not trying to be mean or cruel, but it's sort of like you really don't want choosing your therapist to be an impulse buy, right? Mm-hmm. You want to think about it a little bit.
Yeah, that makes sense. Because if I choose it with an impulse, I may choose somebody who is not the correct fit for me.
Yeah, and you may discover that 4, 5, 7, 10 sessions in, and then you spend all this money and time, and you're not really any closer to better. I mean, you can use the information that the therapist gathered. You can write a release, and they can send it to whoever you end up with if you want. So they know what happened in the sessions, if that's important. But like, most people, it's just if you hurry it and you pick the wrong one, you're going to waste your money. You're going to feel frustrated, angry, disappointed, and then you're still going to have to find the right one anyways. Mm-hmm. So better to try to get it right sooner rather than later.
So how do I know when I choose the wrong one?
If you choose the wrong one, it's like, you find yourself wondering, should I say that to that person? Do you find yourself wondering, do they really understand what I'm saying? Are they paying attention to you? One of the things that I find, I think, most healing about therapy is for someone to really, really listen to you. Give you their full attention and be there with you in the moment. That can be very healing. And so, they shouldn't look bored. They shouldn't be checking their phone messages. Other red flags. I find people who are therapists who are consistently late to their own appointments, run away. Yeah. It's just like, this is important. And they schedule a time that supposedly was convenient for them. So, every once in a while, someone gets stuck in traffic or they have an emergency with their previous client in something, but they will do their best to call you to let you know, I'm so sorry, but if you constantly feel like you're not important or you're being brushed off, or you're not a priority with this person, it doesn't feel good being in their office, listen to your gut and see what else is out there. Because especially, I think, if you find the right one, you'll have a very different experience, and it'll just feel right.
Okay, that is very useful because nobody ever told me how to what I will be a grown, because I will think I am the grown person, not my therapist.
Yeah, and even you can find a therapist who's doing it 40 years and is at the top of the field, is amazing. Mm-hmm. But if there's not the personalities don't click, it's not the right person for you. And that's okay. No therapist can possibly treat 100% of people. Right. And so it doesn't have to be about you. Just trust that this doesn't feel right, and I'm going to go find the person that does feel right.
So, Dr. Steve, I hear in the phone call that when you told me the fee was $200, why, if you are only talking to me, why you charge $200?
Why do I charge $200?
You don't put, other than the office, you don't put only talking. Yeah.
Right. But I had to go through undergraduate school, and then I had to get a PhD, which is 4 to 7 years usually. I had to do 3,000 hours of licensing hours. I had to pass a national exam and a California exam. All of that took time and money and effort. Time and money, effort where I wasn't drawing a paycheck. So that's one thing. The other thing is I offer something very valuable that most people can't do. And I have a lot of responsibility. Maybe I'm dealing with a suicidal patient. Maybe I'm dealing with, a lot of trauma. Maybe I'm I love what I do, but that doesn't mean it's always easy.
So the way you say it is like, if I am willing to pay $200 to the one who is putting anesthesia on me, no? The doctor who is putting anesthesia on me.
Putting on
anesthesia? To put me to sleep.
Oh, yes.
It has a lot of responsibility over me.
Yes. He literally has your life in your hands.
Yes. And, sometimes if you have me in the session, I guess sometimes it's the same.
Sometimes. But also just that, it's, I don't think everyone can do what we do. And I think what we provide is very valuable. And that I think actually being happy and having actual mental health is priceless. And so I'm not trying to be greedy, but I'm also trying to be realistic. I mean, the other point is that I personally can't see more than 20 clients a week without feeling a sense of burnout. So I don't, it's not like I'm working 40 hours a week, so I also have to adjust my fee to accommodate that fact, and I may make other money outside teaching or consulting or other things, but when I'm working as a therapist, I am working. It's not like I'm just sitting on my butt and saying, and how do you feel about that?
Yeah, all of that makes sense. It makes sense. And when I go to psychology today, or when I start shopping around, I see other therapists, they charge 250, 300. This also has to do with the area, I guess. The
area, the level of experience, maybe they have a specialization that not a lot of people do. And I realize money's a reality. It's a reality for me too. And I also say there are there are low fee clinics. There are places you can go if you really can't afford it, or you don't have the insurance. But I can't do what I do without making a decent living. And frankly, I shouldn't have to.
So you mentioned something when I did a phone call about the sliding scale. What is that?
So sliding scale is therapists will provide a range. It's like my fee's $200, but for some people, I'll see people from between like $100 and $200, and sometimes I do that for graduate students who are doing their own therapy, who are going to be psychologists or MFTs or therapists. I will do that as sort of a way of giving back to the profession. And occasionally I will do it because I don't accept insurance. And so maybe 200 is too much, but maybe 170 is okay or something like that. And so then if I feel good about that and I don't feel like someone's trying to take advantage of me, I might agree with that, but that's entirely up to me. You're not buying a used car. So, I think haggling in some cultures is appropriate, but when people start doing what I do professionally, that's a sign to me that they don't really value what I do, and I don't accept them as clients. And I'm not trying to be mean about that, but
yeah. Well, I can tell you as a therapist personally that I have a certain amount that I don't go under for any circumstance.
Me as well.
Because I need to pay insurance and rent and fees and
continue education classes and
the license, and I mean half of my salary goes to people who live from my profession. Yeah.
Yes.
And sometimes I told one client, if I got so down, I am paying to give you therapist.
Yes.
At some point, I'm paying myself to give you therapist. So I don't entertain as much. So there are clients for everybody.
Yeah, and I think therapy is different, especially if you're going to see someone who's not accepting insurance. Because when you go to the doctor, you don't haggle over fees.
No.
Right?
No, that's right.
And so, and usually insurance is going to cover it, and it's just settled. Right. And it's a little less settled with therapy, but you're still dealing with someone who spent a lot of years to get where they're at and is a professional and an expert and deserves to be treated as such.
Okay. So another question that I have is how long is appropriate for me to be in therapy, or how do I know when it's time for me just to rest from therapy?
There are some therapies that it's 6 sessions or it's 10 sessions, and they're very, very brief, and it's usually dealing with a very specific issue and not necessarily a particularly deep or entrenched one. I don't work that way. I work a little, usually longer term, and I really trying to provide the context, see where this is coming from, help you do what you need to do to get over it, help you get to where you want to be in the future. And so I don't have, when people ask how many sessions, I honestly don't know. And it depends on what the problem is, how willing my patient is, and willing and able my patients to kind of engage with it, and how and what I can do on my end. It's different. And so hopefully people start to see progress. And as long as they're seeing progress, they feel good about going. To be fair and honest, often in therapy, you will feel worse for a while.
Okay.
Possibly. In that a lot of things you haven't been thinking about and you've been shutting away because they've been very painful or whatever, when those come out into the room, it can be difficult for a while. But you stick with it and you move through them and you come out the other side. And so my goal for clients is eventually, patients or clients, people, whatever term you use, is that eventually they have the skills and the knowledge and the abilities and the experience that they no longer need me. They can manage their emotions. They can manage whatever the condition is. They've healed whatever wound was there. They've learned whatever skill there was, and then they're perfectly capable of resuming their life and doing what they want without having to see me each week. And then I think it's like, oh, it's time to stop. And there are also sometimes life circumstances happen where it's just too much to be in therapy and deal with whatever. And maybe it makes sense to take a break for a little while to manage whatever. Maybe you're changing jobs or you have to move or whatever it is. You take a little break and then come back. But I always encourage people when they're wondering if therapy isn't going well, or they think they're done, or they might be done, or they're not sure, just talk to your therapist and have a conversation. The two of you will figure it out.
Yeah. Sometimes as a therapist, what I do is when they start getting late, or sometimes it's a little different dynamic in the room, I ask them, do you want to keep going? Do you want to rest from therapy for a while or something? Because it has a flow, sometimes that the client presents.
Yeah, I know some people are late or they're canceling a lot. I'll have this conversation. What's going on? I've noticed lately you've been late several times. You've been canceling. What's going on? And I don't immediately bring up do you want to be in therapy anymore? But I want to have a conversation about what's going on and what might be unsaid.
Yes. So that said is if you are in therapy and you feel that way, bring the conversation to your therapist.
Yeah, I mean, every time you feel something's off or not right or unsure, it's always worth the time and the effort to have the conversation and figure it out. Because the more things that are left unsaid, it's sort of like the elephant in the room, and it starts distracting from whatever work you're doing. So talk about it when it's still small, rather than when it's this huge thing.
Do you have something else that we didn't cover?
I think I just want to say that it can be weird going to therapists, and most people see us as like authority figures. In a way we are. But don't let that get in the way of you being in touch with what feels right for you, and make good decisions for yourself. I mean, this is for you and nobody else. So, say yes to the things that seem to be working and say no to the things that don't. And give yourself the power and the permission to do that. Therapists really want you to get better. And if you're not getting better with them, they want to figure out why. So either they can change something, or they say, you know what, I don't think this is working and we need to find someone else so this will work. And I consider that just as valuable a service. I was the one that helped you get it through it all. And in a bigger picture, a lot of times people will go to someone, they'll do a piece of the work, they've had enough, they'll take a break, they'll come back to the other person, or maybe they find someone else, they'll do another piece of the work. That's totally acceptable too. Don't feel like all your eggs in one basket and you have to get it done in this one shot. Just focus on making progress.
So what I learned from you today is that taking my time to choose a therapist will pay off. Oh,
absolutely. Absolutely. In terms of you getting better, money, time, absolutely.
Yeah, that's very nice to know, because it gives me my own power to choose.
Yes, and that's what I really would like your listeners to identify, is you have power. Use it wisely.
Sometimes it doesn't feel that way when I am constricted to one insurance, for example.
Yes.
And I probably need to pay out of my pocket or things.
Yeah, and You know, insurance in a lot of ways is a wonderful thing, but they are in the end in the business to make money. And so are we, to be fair.
Yeah.
But, you know, a lot of the decisions get made at a bureaucratic level and not necessarily a clinical level. And so there are constraints. There are constraints. And hopefully if you have insurance, you can find someone that you really like working with that takes your insurance. But if you can't, in my opinion, if you can afford it, it's better to find someone out of pocket that really going to work rather than trying to squish yourself into this little box to try to make your insurance provider's therapist work for you. Yeah, I just, in the long run, I don't think you're going to get what you want.
Yeah. So it's about getting myself healthy. Yeah.
Yes.
And working around with what I have. Sometimes insurance, sometimes not.
Yes.
Okay. Well, that was very helpful. I think our listeners will be at least less scared to do the first phone call. Yeah?
Yes, I hope so.
I hope so. And thank you really for being here again. And looking forward for other interviews when we have new topics or when we get new ideas or something.
That would be great. Thank you for having me. I've had fun once again.
We laugh less today.
Well, yes.
We were talking about money.
Well, money gets real serious real soon, yes.
because in the other episode, we laugh a lot and I think people enjoy it.
I think in some ways emotions are easier to deal with than money.
Yeah, that's right. But when you have the right therapist, please laugh and please share with us that you laugh about it. Okay, bye for now.
Bye.
Thanks for listening to this episode. Join us for the next podcast of Emotions in Harmony. We hope you have more tools to put what you have learned here into practice. Visit carmenroman.net, where you can be in touch with Dr. Roman.